This week's topic is on Chapter 8. We will be focusing on caffeine and its effects on physiological functions and physical and mental performances. We hope you are able to learn some information from our presentation. Enjoy. Let's begin with a quick introduction to caffeine. Caffeine is the world's most commonly used drug throughout the lifespan and is regularly consumed by 90% of the world. Most people would not consider caffeine as a real drug before consuming it. Caffeine to some of us might be like drinking water or juice. Before we move on to the main part of the presentation, I would like you to think about caffeine and its impact on your own health. How seriously do you take the effects of caffeine on your health? Keep your thoughts in mind.
So, what is caffeine? Caffeine is a methylxanthine along with theophylline and theobromine, which are all alkaloid compounds. Alkaloid compounds are naturally found in plants, contain nitrogen, and are physiologically active. Caffeine is the strongest of the three methylxanthines and is a mild central nervous system stimulant. Caffeine is most commonly found in food and beverage items such as coffee, tea, energy drinks, soft drinks, or items containing cocoa. Caffeine is also commonly found in prescribed or over-the-counter medications. Over-the-counter medications such as anisine and ephedrine are often mixed with heroin and cocaine as a filler. The methylxanthines have been used in beverages since the Stone Age or earlier. However, coffee was not well known until European explorers discovered it in Arabia, Turkey, and Ethiopia. These same explorers discovered tea in China, the cola nut in West Africa, the cacao plant in Mexico, Central America, and South America. Some sources of tea were also found in North and South America. Before we move on to the next part, I would like you to ask yourself the following questions. Think about these questions and keep your answers in mind. Do you consume caffeine daily? How many caffeinated items do you think you will consume by the end of today? And do you think you meet Health Canada's recommended daily intake of caffeine? Now we will move on to the prevalence of caffeine. Estimated caffeine consumption is typically gathered from a country's caffeine imports and surveys. An exact estimate of caffeine consumption is difficult to produce because it is hard to keep track of the large number of caffeinated items consumed in a given period of time. These surveys are also expensive to conduct, therefore limiting the number of participants. A person's caffeine consumption can vary greatly, ranging from 4 milligrams per person per day to 414 milligrams per person per day. In Canada, the average caffeine consumption is 200 milligrams per day. Health Canada recommends a maximum of 400 milligrams per day for ages 18 and above. However, 20% of men and 15% of women consume more than the recommended amount of caffeine from ages 31 to 70. For adults, the main source of caffeine is coffee. For children and adolescents, it is soft drinks. This section on Canadian children and caffeine expresses the concerns for high exposure of caffeine to young children. This is a concern because the popularity of energy drinks is increasing among children and the exposure of caffeine is high compared to adults. Grayson Wallace found evidence of caffeine withdrawal in children ages 11 and 12. The fact that little is known about the long-term effects of caffeine use in children only increases the concern. Health Canada recommends that children under the age of 12 limit their caffeine consumption to 2.5 milligrams per kilogram of body weight. This is about 1 to 2 cans of cola per day. The Canadian government has limited the amount of caffeine allowed in non-cola soft drinks to 75% of the caffeine content allowed in cola beverages. Non-cola soft drinks are those that are not dark-colored, such as Fanta or Fruitopia, which are popular among young children. Now getting back to the prevalence of caffeine, cocoa is primarily produced in Africa, and its consumption continues to increase worldwide, with its main consumption in developed countries. The consumption of coffee since the 1980s has only risen slightly, but any decreased intake of caffeine from beverages was compensated by soft drinks. As a response to the reflection questions, this is just a short activity where you can add it up. These numbers may not be exact and only include the most common caffeinated items, but will still give you a general estimate of your daily caffeine intake. This table only includes beverages. And this table includes food items. You can pause this presentation if you would like to complete the activity.
And now I will be talking about a scholarly research article. It is called the Journal for Nurse Practitioners. Within this article, we will learn about the pharmacology and the pharmacokinetics of caffeine, the presentation and management of intoxication, caffeineism, and the chronic medical conditions. Lastly, the education and implication when it comes to caffeine and caffeine intoxication. Drinks like the Rockstar, Red Bull, liquid cocaine are amongst the many caffeinated drinks which have extremely high levels of caffeine than the current Food and Drug Administration would allow. So, how are they able to get away with this? All these drinks have certain ingredients such as fructose corn syrup, sucrose, and herbal additives like taurine, L-carnitine, ginseng, and milk thistle, thus placing them as healthy alternatives for a quick energy high. This graph here is a great example of popular energy drinks and their caffeine content. As we can see, the drinks with the most caffeine is cocaine 15, while the least amount of caffeine content is balls 12, but that doesn't mean it's the safest to consume. Now we are going to learn more about the pharmacology and the pharmacokinetics of caffeine. Caffeine can be naturally produced by plants like guarana, cocoa pods, and kola nut. Artificially, it can be created with the use of a family of chemicals called methylxanthines. So, what's happening? What are all these chemicals doing to our body? Methylxanthines causes the release of hormones called catecholamines made by the adrenal glands. And to those of you who may not know where that is, it's located within the kidneys. More specifically, the main catecholamines are epinephrine, also known as adrenaline, norepinephrine, also known as noradrenaline, and dopamine. What happens next is when the catecholamines release, they start blocking the inhibitory neurotransmitter adenosine and restraining the phosphodiesterase. So, what are all these and what does it mean? Essentially, the adenosine normally acts as a central nervous system depressant and normally promotes sleep and suppresses arousal. By consuming caffeine, the adenosine is not able to do what it's supposed to. Thus, why we feel such a buzz and don't feel like sleeping. What is the presentation of caffeine intoxication? According to the DSM-4 and the World Health Organization, also known as WHO, have detailed that the diagnostic criteria for caffeine intoxication is that a person must have consumed an excess of 250 milligrams of caffeine and show signs such as restlessness, nervousness, excitement, insomnia, flushed face, diuresis, gastrointestinal disturbance, muscle twitching, rambling flow of thought and speech, tachycardia, which is basically when your heart rate is too fast. All these symptoms are just a few presentation of someone who might have a caffeine intoxication. Lastly, all these symptoms cannot be related to any physical or mental disorders in order for it to be considered a caffeine intoxication. We are going to talk about the management of intoxication. When intoxicated, there are certain things that need to be done. An antacid is given for gastritis. If the intoxicated individual is vomiting, they can be given certain drugs such as metoclopramide or ondansetron to control the vomiting. Furthermore, when intoxicated, the drug phenothiazine antiemetics shouldn't be given because it decreases the seizure threshold, which increases the risk of seizures. Caffeineism and chronic medical condition. So, how is caffeineism and chronic medical conditions related? Prolonged consumption creates prolonged stress response in the body by continuously antagonizing the adenosine receptors, inhibiting the phosphodiesterase, and increasing circulating catecholamines and intracellular cAMP, which is essentially a second messenger important to the biological process. This can lead to increase of blood pressure and heart rate, release of blood glucose by the liver, increase in gastric acid secretion, decrease in lower esophageal sphincter tone, and increase in colonic contractile activity. All of these are chronic medical conditions. The last topic that the article touches upon is education and implication. It's important for us to always be actively learning about the different implications caffeine can cause, especially because of how high the consumption rates are. Think of it this way: the more aware we are, the more preventive steps we'll take, which will only help us to secure a long and healthy future. And who doesn't want that? One of these ways are looking at nutrition assessments, which allow a certain understanding of how much drinks are consumed per day. This provides important information on the risk of consumption. We need to read labels and be aware of the other names caffeine can take. Furthermore, individuals diagnosed with diabetes, hypertension, IBS, or gastroesophageal reflux disease need to be more careful about caffeine because their health can be more affected at a dangerous rate than others.
Now moving back to Chapter 8, caffeine is rapidly absorbed in the gastrointestinal tract and quickly reaches the brain because it can easily pass through the blood-brain barrier. The half-life of caffeine in blood can vary depending on the individual, lasting from 21.5 hours to 71.5 hours. The first 15 to 45 minutes after caffeine is taken are the peak of its effects. Caffeine is equally distributed in total body water and can freely cross the placenta to the fetus. After consumption, the concentration of caffeine is similar throughout the body. Caffeine is mostly metabolized by the liver, and almost all excretion is done by the kidneys. The rate of metabolizing and excreting caffeine are slower in people who have been using caffeine over a shorter period of time. Other factors affecting these processes are liver disease, pregnancy, and the use of oral contraceptives, which slow it down. The use of cigarettes fastens the process. Caffeine has been considered a strange drug because of its unusual potential for inducing tolerance and physical dependence. There is even evidence of caffeine withdrawal syndrome, and an individual's pattern of caffeine usage can meet the Diagnostic and Statistical Manual of Mental Disorders criteria for drug dependence. Caffeine withdrawal symptoms include headache, fatigue, depression, decreased alertness, less contentment and a relaxed mood, decreased activity and energy, greater sleepiness and drowsiness, and increased irritability. More research needs to be done on the tolerance of caffeine, but it is probable that caffeine tolerance affects renal function, sleep, heart rate, blood pressure, and other physiological functions not listed. As we now know, caffeine's primary action is to stimulate the central nervous system. However, its effects can be seen outside the central nervous system as well. There is evidence of caffeine's actions in the contraction of striated muscle, relaxation of smooth muscle, stimulating effects on respiration at higher doses, and various enzymatic and endocrine effects. Caffeine's effects on the body also provide good evidence that it blocks adenosines due to its contrasting mechanisms. Research has shown that caffeine can elevate mood. Moderate doses of caffeine can be associated with feeling energized, creative, efficient, confident, and alert. There are several side effects of caffeine. For example, dizziness, blurred vision, thirst, increased urination, anxiety, and irritability. In terms of performance, caffeine can improve test performance by decreasing fatigue, increase vigilance so that performance does not drop below what is typical for a person, improve motor ability, and impair decision making. Caffeine's effects on performance can be complicated since each component of a task can be affected differently. The dosage, setting, and the personality of a person can also alter the effects. As with other drugs, caffeine can also have toxic effects. The risk of caffeine intoxication increases greatly if you consume 600 milligrams of caffeine a day, which is 200 milligrams over Health Canada's recommended daily intake. Caffeine intoxication can become deadly if adults consume 10 grams a day, or if children consume 100 milligrams per kilogram of body weight. Symptoms of caffeineism include trembling hands, increased respiration, confusion, delirium, headache, seizures, fever, tachycardia, and vomiting. Tachycardia is when your heart rate is over 100 beats per minute. A normal heart rate is 60 to 100 beats per minute. Although caffeine has some negative effects, it also has some good uses as well. Caffeine can be used to treat headaches and colds or used as a respiratory stimulant for premature infants and as an appetite suppressant. Theophylline can be used to treat cardiac and bronchial asthma, and theobromine causes diuresis, which can help balance bodily fluids and salt. Much more research is needed to determine accurate data for chronic effects of caffeine. Based on available research, caffeine can potentially prevent liver disease, Parkinson's disease, and type 2 diabetes. Some research also suggests prevention against liver cirrhosis and the development of Alzheimer's disease. Next, we will go into further detail about the effects of caffeine on human health with the help of a meta-analysis. In this section, you will learn about the physical dependence and withdrawal of caffeine, bone density and calcium, and caffeine's effects on conception, fertility, and fetal growth.
Physical dependence and withdrawal. When an individual relies on caffeine and depends on it to function, not having their normal caffeine intake can cause withdrawal symptoms. These effects can vary from person to person, but some symptoms include headache, fatigue, weakness, apathy, and decreased alertness. A blind study was done by Dews in 1999 on tolerance and withdrawal. Participants were given caffeine and were then placed into groups. One group had continued caffeine intake, while another group had an abrupt caffeine cessation, and the other group had a gradual caffeine cessation. The group where subjects had to have gradual caffeine cessation reported no adverse caffeine side effects. However, in the group where they had an abrupt caffeine cessation, the females in particular had adverse effects. On days where they didn't have any caffeine intake, they demonstrated a reduced mood and scored negatively on an attitude scale. Caffeine's effect on bone density and calcium. When females have a lifetime pattern of high caffeine intake, it can negatively impact their bone density and calcium. Having a high caffeine intake for many years is correlated with bone loss and fracture risk. In particular, it is especially prevalent when there is already low calcium intake in the first place. In a study by Bruce and Spiller, they found that the significance of caffeine's potential to affect calcium levels and bone metabolism really just depends on lifetime caffeine intake and how long the individual has been drinking caffeine for. They found that this correlation is more biologically relevant in women. Researchers have found that caffeine's effects on bone density were actually dependent on the individual's calcium intake. Barrett, Connor, and colleagues found that only postmenopausal women who didn't report drinking at least 1 glass of milk per day between the ages of 20 years old to 50 demonstrated a caffeine-associated decrease in bone mineral density. Data from the Nurse Health Study also found that women who consumed more than 4 cups of coffee per day had a higher risk of hip fractures than those who never consumed coffee. Caffeine's effects on conception and female fertility. Caffeine consumption has been associated with the alteration of hormone levels, with tubal disease, which is a fallopian tube disorder, endometriosis, and with reduced viability of the fertilized ovum. Results from 2 studies indicated in the meta-analysis showed a significant decrease in monthly probability of pregnancy among women who consume the equivalent of 3 or more cups of coffee per day. Studies show that women who were heavy coffee drinkers before pregnancy, drinking 4 to 7 or more cups of coffee per day, experienced almost double the time in becoming pregnant compared with women who consumed none or 1 cup of coffee per day. In a cross-sectional study, Hatch and Bracken found that the intake of caffeine from coffee tea, caffeinated soft drinks were associated with an increased risk of delay of conception by up to 1 year. Caffeine's effect on fetal growth. Throughout the years, there has been a growing concern over the consumption of caffeine during pregnancy and its effects on fetal development. Published data indicated in the meta-analysis suggests that the fetus may be exposed to substantial amounts of caffeine or its metabolites due to the fact that caffeine ingested by the mother is rapidly absorbed in the gastrointestinal tract and readily crosses the placenta. It is then distributed to all fetal tissues, including the central nervous system. The consumption of 2 cups of coffee during pregnancy has been reported to increase maternal epinephrine concentration and decrease intervillous placental blood flow. Smoking and caffeine consumption impose similar adverse physiological effects on fetal development. There is a persistent association between caffeine consumption during pregnancy and low birth weight. This was observed in 8 original studies, which strongly suggests that caffeine may adversely affect fetal growth. Caffeine consumption leading to negative fetal development effects has been supported by a meta-analysis study, which involved a total of 64,268 pregnancies, which reported a statistically significant increase in the risk for low birth weight babies in pregnant women who consume more than 50 milligrams of caffeine per day.
Overall, when it comes to drugs, caffeine is on the least dangerous end of the spectrum. But that doesn't mean we shouldn't be careful. Just like anything in life, overconsumption is never a good idea. We always need to find a balance, especially when it comes to our health. There have yet to be many more studies done on the various aspects of caffeine and its effects on our physical, mental, and biological health. With time, the many questions we still have will hopefully be answered. At this time, now that we have taught you all about the physiological functions and the mental health and physical performance on caffeine, please take the time to answer these 2 discussion questions. Question number 1. We know that when mothers are pregnant, they are not allowed to drink alcohol or take drugs since it can cause harm to the fetus. There have been numerous cases where babies have been born already addicted to certain drugs that the mother consumed during pregnancy. After everything you have learned today on caffeine, do you think it's okay for pregnant mothers to consume caffeine while pregnant? If so, what do you think the short-term and long-term effects will be on the child? Question 2. Before the start of this presentation, we asked you to think about caffeine, its impact on your health, and how seriously you take it compared to other drugs. Now that you have a more in-depth knowledge of the drug, have your views on caffeine changed from the start of this presentation? Why or why not? Thank you for taking the time to listen to our presentation and hope you have learned as much as we have while doing our research. Thank you and have a wonderful day. Bye!